So today's video is going to be on SI joint dysfunction, specifically non-surgical treatment and the best exercises. Now, I'm teaming up today with Miki Burton from Motion Restoration, and Miki's going to be doing the exercise section. She is an expert in the field. She's a registered massage therapist and also an instructor. So we're going to get some great advice from Miki today, and I'm going to put links below the description there to her YouTube channel on there. It's a great channel and you really need to check it out. So Miki, why don't we just have you lie on your back here for a sec. SI joint problems are probably one of the most frequent things that we treat in clinical practice. Miki, I think you've actually had some experience with that over the years too.
Oh, just a few.
Yeah. So it's not a matter of just going to the SI joint, the connection between the sacrum and the ilium, and working on that area, but we have to consider a larger kinetic chain. So one of the most common things we'll do is actually check out the hamstrings first. Why this is so important is because if the hamstrings get tight, they are going to pull the pelvis posterior, you're going to start to lose the lumbar curvature, and you're actually going to lose your shock absorption capacity. And that's going to put a lot of force through the entire pelvis, including the SI joints. So let's just see if your hamstrings are nice and loose.
Oh yeah.
Once again.
So
Okay.
limber.
So let's just get on the hamstrings a little bit here. Doing okay there?
Yeah.
I can always tell she's okay when she stops breathing.
Yeah.
All right. So just get in there and kind of work it away. Don't go too fast, but get in there enough to actually open up the structure. You okay?
Yep.
I really believe you here.
Yep.
Okay. So let's go to the other one here. It's amazing how tight hamstrings can be, and people will stretch them forever, and they really will not elongate as much as they should. And part of the issue is there's an imbalance between the quadriceps and the hamstrings. So one of the key things you can do to actually elongate the hamstrings is to strengthen them. Doing deadlifts or getting on a Swiss ball and doing Swiss ball and doing hamstring curls. These are all great exercises. So after we've worked on that for a little bit, we would also go on to the adductors. So, and just see how tight they are. Actually, that's not bad compared to what it is
It's pretty good.
sometimes, yeah. Not too bad there. And then we're going to get on the other one. All right, now that's a little tighter.
Yeah.
Okay. Now, what I'm going to get you to do is I'm going to get you to turn on your side towards me, please. So, SI joint back here. I'm going to start working around along the edge of the joint there. You okay? Okay.
Oh my gosh.
Pretty tight. Okay, so if I'm here and I take your leg here and just kind of bring it around here a bit, that really increases that, doesn't it?
Yeah.
So we are getting some motion in the SI joint as we are going through this. Keep breathing. Good. Take your leg up a little bit and down. Up and down. So one exercise I think you're going to be showing later on is knee to the chest. So if I can open that up a little bit before that, it's probably going to help you get a little more mobility in there.
Mm-hmm.
So let's go back on that again. You okay?
That's way better.
Good. Okay, so I'm just going to check the SI joint. And if it's within your scope of practice, you should probably either do mobilization or manipulation. You okay with me adjusting this joint here?
Mm-hmm.
Okay. It's down here. Take this back. All the way over. And right down. Good. Excellent. Other side. Good. Now. And once again, we are a wee bit tight. You okay?
Yeah.
And once again, I'm going to take the leg here, take it around. Are you okay?
Yeah, that's good.
That really intensified it though, didn't it?
Cow.
Yeah. Good. Down. This up and down. Up and down. This side's a little more stubborn than the other side. Okay, there we go. Starting to let go a little bit.
That's way better. Yeah.
Okay, let me just check things out here a little bit. This here, back down. Back down. Perfect. Excellent. Okay, I'm going to get you to lie on your side and face over, please. Now, we're always considering antagonist muscles, such to the glutes would be the hip flexors. I want to see whether these are very tight or not. Not too bad. A little bit. Okay, bring your leg back as far as you can, behind. Bring your knee back.
Oh, sorry.
There we go. And down. Perfect. And again. Okay. And back. Okay, you should lie on your back actually. Doesn't feel like we're getting in there quite as much as I'd like to. So open up a bit more. Come to the edge here a little bit. Okay. All right. Doing okay?
Yep.
Bring your leg down. There we go. Back up. How's that feeling?
That's way more intense.
Yeah. The other one was, it can be effective in certain situations, but I think this one is way, way more effective to get in there a lot more. You okay?
Yeah.
Good. Okay, turn back on your side this way. Take your leg back. Oh yeah.
That's way better.
Okay. Let's have you actually turn to the other side. Let's check this one out again here. Bring this up here. Bring your leg back. Knee back. Yeah, that's very tight. Lie on your back, please. That just locked right in there right away.
Yeah, my right side is worse.
Okay. Now down here. Bring this down. Doing okay. Back. And again. And up. And again. Back up. Good. Okay. One other thing I want to check here is actually the facet joints and thoracic area. If we go over to the model here and we see where the SI joints are here, one thing that's very important to look at is the entire spine. It works as one force distribution mechanism. If we have a facet joint in between here stuck at any point all the way up here, we won't be able to dissipate force. So you may have force here that's generated and it actually translates up here, but then it's like it doesn't really release that well because you have another restriction in another area. So I'm going to check out that mid-thoracic area just to make sure nothing is restricted. You okay with adjustment there?
Oh, yes.
Just turn this way a bit. Good. Back over. Lift your head. Up, up, up. Good. One more time. Up, up. Perfect. Okay, come on up here. Just stand up over for a sec. Raise your knees up and down. Both sides. Okay, how's that feeling there now?
Good.
A little bit looser?
Yeah.
Okay, good.
A lot looser.
Okay, now that I've shown you some of the basic treatment modalities, different ways we can address certain things there, let's get on to those great exercises.
Sounds good.
All right, so we're going to be going into some of the dynamic or mobility type movements for when you are suffering from that SI joint pain. Now, I am somebody who has suffered for the past 23 years from back pain. So when I say I do these myself, I am meaning I do these myself. And I found that what I have comprised is what has helped me out the most. Now, some of them you're going to do a little bit later. Some of them you're going to do right away when you are in that acute phase of pain. But when you've kind of had a little bit more movement, the mobility is the best way to go. So what I like to start doing is I'm going to be on my knees, and I'm going to, instead of going straight out in front and just doing a nice stretch for the front of the body, what you're going to do is you're going to go out at a 45-degree angle, and then you're going to be tracking your knee over your toes to the side, opening up the hips. So you're going to go in a nice fluid movement and then going back. So putting on a timer for at least 45 seconds to 1 minute, keeping a nice cadence, going in and out of this movement. Eventually it's going to feel nice and limber, and then you're just going to move your foot out even that much further and lean into it that much more. Don't forget, you want to do both sides, putting on that timer 45 seconds to a minute, really leaning into it, opening up those hips. Another great one to do is going to be the pelvic tilt. So first thing in the morning, right when you wake up, you're laying in bed, all you're going to do is bring your knees towards your bum. You're going to have a good range of motion, meaning you can still have room to put your fingers down, and you're not going to be directly into your bum with your feet. So have them nice and out. All you're going to do is tilting the pelvis up and then relaxing it back down. Tilting and back down. So this is all we're going to do. Nice movement, again, 45 seconds to a minute. And then once we're done our pelvic tilts, we're going to do a march. So you're going to engage left leg, nice and slow, engage right leg, feeling those muscles contracting. So this one's really good for helping with stabilization as well. So just moving the pelvis. Some people also notice a little creaks and cracks in their low back as well, and that's okay. So just doing some nice marches. All right, and then we're gonna sit up and we're gonna do a figure four. So figure four, sometimes starting with our legs straight, you're gonna cross the ankle over and letting it relax, and even sitting in this, take a few breaths just to get into the movement, and then we're gonna bring the leg up, nice and slow. So the closer we bring it into our body, the closer we bring our body to our leg, the more you're gonna feel the stretch in that gluteal and that low back region. And then pressing forward, and then relaxing. So going through this nice fluid movement, bringing it in, pressing forward, using your breath. Pressing forward, just like that. All right, and then we're gonna do what's called windshield wiper. So for that, you're gonna be sitting same position we're already in. So bringing knees, but your knees are gonna be a little bit wider than hip width, because we're gonna be bringing and dropping them down to the side. So your goal is to try to touch the knees down to the ground. If you can only get to here because it's painful, then that's all you can do today. So back and forth. So these are really good to do, especially when you're first noticing that pain. I love doing these first thing in the morning because it just adds a little bit extra fluidity to my low back. And then another really good one to do is, we've all seen the butterfly, which helps to stretch out the adductors. Well, the further out your feet are, when you lean forward, you're actually going to be going in more into the low back versus into the adductors here of the legs. So bring your feet out a little bit more, and you're just gonna lean forward and then back up and forward. Try leading with your chest and then back up. So it's gonna open up that low back more versus being a stretch into the adductors. So nice movement in here. Just like this. And then one of my favorites is always that bird dog. So this is where we are in quadruped. So we're on all fours and we're gonna go the opposite leg, opposite arm. Now I want you to think, brace that core. You're gonna bring that belly button into that spine, keep everything nice and tight. We're not kicking our leg back into a glute workout. So I want you to think the leg goes in line with the body as the arm stays in line with the body. And then back in, and then extend. I also like to point my toes down, heel down, just like this. So I want you to do 45 seconds to a minute on just one side, and then when the timer beeps, you're gonna switch it to the other side. Try to make sure that we're not tilting the body. Even if this is all you can do that first few days is dragging the toes and dragging the arm, you're doing great. Just gotta work yourself up to getting into that full extension. Bracing that core. So those are just a few quick mobility exercises that are great for the hips and the low back as well. Sometimes doing that static holding stretch, I found, especially when I'm originally getting that flare up, it's really hard to get out. And I found that if I just do more of the dynamic style of movements versus that static hold, it's a lot easier for my body to get used to that movement. So I hope that helps you out as well. So for the strengthening portion of the SI joint video that we're doing, some of the exercises might notice I can't do that right now, and that's okay. You have to start off quite small, just like starting with pelvic tilts and minor things just to get mobility into the area would be helpful at first, but then we want to get ourselves into that strengthening portion. Again, what I found that worked best for myself, this is what I'm going to be showing you today. I'm going to be doing it as body weight, but the better you get, the more I want you to incorporate some weights with it. First one that we're going to do is you scooch your bum forward, you scooch your bum back. It's hard to explain, it's easier to show. So you're going to be sitting, legs are going to be stretched out in front of you, and you're going to lift up that left hip and drop it forward. Lift that right hip. So you're focusing on strengthening the low back muscles. So all you're doing is scooching your bum forward, and then you're going to go reverse. So we bring it back. This is quite tiresome on the low back. So the first few times that I did it, I got maybe 8 scooches forward and 8 scooches back before everything started to kind of seize up on me. So if you can get between 8 to 10 forward and 8 to 10 coming backwards, you're doing great. So then we're gonna go into the bridges. So your bridges, you're going to be bringing your heels so you can touch them with your hands. I always like to put my toes up so I know that I'm driving through my heels. We're going to be driving the pelvis up and back down. So doing our bridge, and then when this starts to feel good, then you're going to be adding that weight. Now, even when I first start to hurt my back, and I do these, I like to really come up, and then when I'm up here, I like to really squeeze the glutes, and then nice and slow back down, relax. And then contract up, really squeeze the glutes, and then back down. So with that body weight, 3 sets, 10 reps, you're doing phenomenal. Eventually working up to adding in that weight. Next one we're gonna do is you're still gonna be doing a bridge, but you're gonna bring your heels together, knees fall out to the side, and you're going to be pushing up through your heels. So push up, contract the glute muscles. So we're working a different set of glute muscles when we have our legs out like this. So push up through your heels, squeeze at the top, back down. 3 sets of 10. Again, eventually you're going to add in those weights. Just like that. Perfect. All right, so next one, we're gonna go onto our stomachs here. So we're gonna lay on our stomachs. You're gonna have your arms, and a lot of the times you've seen things like a swimmer's, where it's opposite arm, opposite